Hello, I'm Jolene. I'm an inpatient pharmacist and a medication safety officer. I've been working as a pharmacist for 5 years at Woodlands Health Campus, which is this new hospital that is planned to open its doors to patients in 2023. On days when I'm covering the ward, I typically start my day by conducting medication reconciliation for newly admitted patients into the hospital. Medication reconciliation is a process of creating the most accurate list of all the medications that a patient is taking. So this is achieved through patient and family interviews, through assessing the patient's online electronic health records, and through contacting other institutions that the patient may be on follow-up with. Thereafter, I will join in morning rounds with the team, consisting of doctors and nurses. So while the team reviews and makes plans for the patient, my responsibility is to review the medications that have been prescribed by the doctors to ensure that the most appropriate medication regimen is selected. There are also weeks when I'm scheduled to round with the nutrition support team. So this is a multidisciplinary team consisting of specialist doctors, dietitians, and pharmacists. We work together to take care of patients who require parenteral nutrition. So these are patients who cannot take food orally for a prolonged period of time and hence require nutrition to be administered through a blood vessel. Together as a team, we work to optimize the nutrition that these patients need so that we can ensure they'll meet their daily caloric requirements. As pharmacists, we work closely with doctors to ensure that medications prescribed for patients are suitable, evidence-based, and cost-effective. As antibiotic stewardship pharmacists, we strive to ensure that antibiotics are judiciously used to treat infections. This is so that we can reserve the stronger antibiotics to fight the superbugs and also ensure that our future generations will not suffer from the consequences of antibiotic resistance. My role as a medication safety officer is to coordinate and strategize with various stakeholders to ensure that our systems, our environment, and our staff are capable of ensuring that patient safety is the utmost priority. On a regular basis, I analyze the department's errors and near misses to identify any red flags, trends, or gaps that we may have. When a medication error occurs, it's usually not attributed to a staff alone, but the root cause can usually be likened to that of a Swiss cheese model, where contributors, when aligned together like holes in cheese slices, can lead to things falling through the gaps and hence resulting in an error. Thus, an important role of a medication safety officer is to advocate for a just culture, one where our staff are not afraid to speak up in the event of a medication error because they fear of punitive action. We do this by ensuring that we are transparent in all that we do, by supporting our staff, and also by raising awareness through various campaigns. So the COVID-19 pandemic has definitely changed the landscape for hospital pharmacists. We had to do extensive re-evaluation and modification of our operations on the ground. During the peak of the pandemic last year, we faced new challenges such as ensuring that our patients had sufficient supply of medication, overcoming language barriers for our patients who did not speak English, and on top of it all, we wanted to ensure that we continued to provide optimal care for our patients despite minimal face-to-face communication. In the future Woodlands Health Campus, I foresee a workplace where we are more technologically advanced with greater capabilities to provide our patients with better and safer care. With technology creating more efficient systems and taking over the menial and routine tasks, I hope that it will give inpatient pharmacists more headway to focus on things that technology cannot provide to our patients. So this will be things such as the human touch, empathy, and also where creativity is needed to tackle unique challenges to meet the needs of our patients. I look forward to working in Woodlands Health Campus in providing the highest level of care for our patients in the North.